Hello, everyone, and thank you for tuning into Banner Health's Making the Rounds podcast, where each month we speak with medical professionals about different medical topics. This is Caitlin, your host, speaking, and with me today are two certified genetic counselors with Banner MD Anderson Cancer Center, Jennifer Siettmann and Rebecca Luiten. Thank you both for joining me today.
Yeah, thank you so much for having us. We're really excited.
Yeah, thank you, Caitlin.
Jennifer and Rebecca meet with patients to discuss their genetic makeup and risk factors associated with it. Specifically, if someone's family history has a red flag, who do they call? Genetic counselors.
That's right, Caitlin, and I really enjoy that Ghostbusters reference right there too. But most commonly, people think of meeting with a genetic counselor when they want to be tested for the BRCA1 or 2 genes that are typically associated with breast and ovarian cancer. But we actually test patients for all different types of cancer mutations that are found in genes, like colon cancer, thyroid cancer, melanoma, pancreatic cancer, prostate, the list goes on. And then based on those results, we can talk about some of like the next steps for management.
Genetic counseling has become widely known with companies like Ancestry or 23andMe and making it more popular, but there are a lot of misconceptions when it comes to genetic counseling. Jennifer and Rebecca are going to help answer some of those top questions that they receive from both patients and providers and also debunk some of those myths.
Yes, we are, and I'm excited because some of these misconceptions out there are a little wild. We want to help answer uncertainties that patients have when it comes to their family history, as well as help providers know what risk factors to look for and identify when it's time to refer a patient to a genetic counselor.
So I want to start with a little bit of background information for our listeners on how someone finds themselves sitting face to face with a genetic counselor. So with that, Jennifer, can you walk me through what risk factors in a patient's family history should prompt them to be tested for certain genes?
Yeah, it's a really great question. So since cancer is unfortunately really common, there are some risk factors or clues that we'll look for in the family history to kind of tease out what looks sporadic, meaning that the cancer is likely due to outside factors, and what looks suspicious of being genetic or hereditary. So this typically means that there is a change in one of our genes that's increasing that risk for cancer. So typically some of the things that I'll look for or things that doctors might look for are having the same cancer in multiple generations. So like having breast cancer in like your mom, your grandma, your aunt. So we'll see the same type of cancer hitting multiple generations and multiple people. We'll look for young ages of diagnosis. So this is somebody who was diagnosed under age 50. We'll look for somebody who's had multiple cancer diagnoses. So someone who's had like breast and colon cancer or colon and uterine cancer. We'll look for rare cancers that have like a high likelihood of being genetic. So this could be like male breast cancer, pancreatic cancer, ovarian cancer. And then when you give your family history to your doctor, they should be looking at these clues to see if your family history looks suspicious of a hereditary cancer. But you can also use those to look at your own family history too. And then if it looks suspicious, there are two pathways to meeting with one of us. So your family primary care provider can order those genetic tests based on suspicious findings in your family history, and then you can meet with us to discuss those results. Or a primary care, OBGYN, another provider that you see can refer you to a genetic counselor and conduct what we call pre-test counseling. And so that's where we talk about your family history, we provide education, and then we help order the genetic testing and then interpret those results for you. But one of the most important things we talk about with patients is their family history, because that really is kind of what drives everything. So what cancers are in the family currently, and from both sides, so not just from mom's side.
That's right, and that's our first myth.
Yeah, it is. So we want to gather information from both sides of the family, so the maternal and paternal sides. And often we'll hear patients say, oh, well, since that's on my dad's side, it doesn't really matter. And it really does. So we get our DNA from both mom and dad, which means we can get our cancer genes from both mom and dad. And typically we'll gather family history up to our third degree relatives. So from our parents, grandparents, cousins, some extended family members. And just as a reference, your first degree relatives are people who are the closest to you. So this would be like your siblings, your parents, your children. And then your second degree are the people who are just a little bit outside of that. So that would be like aunts and uncles, grandparents, nieces and nephews, grandkids. And then third degree relatives are even one generation further from that. So like great grandparents, cousins, great grandchildren, and then typically relatives that are further out than that are too far removed from us, and their health history most likely won't impact us. That's not to say that it can't, but or that it's not important, but the likelihood that you share a cancer risk with like your mom's second cousin that no one closer to you in your family has is pretty unlikely.
Yeah, that makes total sense. And I want to bring up another myth too is what I don't know won't hurt me, which we've heard this saying in all aspects of life, right? So if my mother had pancreatic cancer, I could possibly have that gene in my DNA. But if I don't know that, I could live my life without having the fear of that I would be diagnosed with cancer.
Yeah, that's true. And we definitely see this patient or this fear from patients a lot. However, knowing your genetic makeup can be very valuable in that first appointment. And what we'd like to share with providers is if that we are recommending genetic testing or you're talking to a patient about genetic testing, is that if your patients have a fear about knowing what the results are, please come have a conversation with us. We're not here to convince anyone that they should or should not have genetic testing. We're just here to talk about the results and let them know that sometimes these results can help ease their fears and anxieties. And based on the results, we can create a game plan to help screen and potentially even prevent some of these cancers. So sometimes we find out that genetic testing isn't the best plan for a patient, and that's okay. We discuss all those options.
Yeah, so and Rebecca's exactly right. And when we, look at genetic testing, there are essentially two ways that results can come back, positive or negative, clinically negative. So a positive result means that we found a mutation in a gene, and maybe that increases your risk for like pancreatic cancer or another type of cancer like breast or colon cancer. And it's important to remember that this isn't a death sentence. We have preventative measures to make sure that we can, take and review with patients and try to help give them options for screening. So, for example, we can do increased screening, which is focused more on early detection. So, if I have an increased risk for pancreatic cancer, I can do upper endoscopies or a special type of MRI to screen for pancreatic cancer. If I have an increased risk for like colon cancer, I can get colonoscopies at a younger age or do them every 3 to 5 years instead of every 10 years. So we can do some increased screening that's trying to catch that cancer early. We can also do more like preventative options as well, which usually focuses on like surgery to remove areas that are the highest risk for cancer. So this could be choosing to have our ovaries removed if we're at a higher risk for ovarian cancer, or choosing to have our breasts removed, kind of like what Angelina Jolie did back in like, gosh, I think it was like 2013 now. But like back in 2013, she chose to have her breasts removed because of an increased risk for breast cancer. So those options are available as well. We can also make recommendations for changing daily lifestyle habits, so like increasing physical activity or decreasing the amount of red meat we eat. So really lots of things we can do to, try to prevent or catch cancer early to help beat it.
Yeah, and while Jennifer just explained kind of what we do if someone tests positive, it's important to know that if you were to test negative and you have a negative test result, that isn't always a golden ticket either. So even though with a negative result, we realize that you don't have, at least at this time, a genetic mutation that's putting you at an increased risk for cancer, you're still a human, you still exist in this world, and there's always a chance that we still have a risk for cancer just by the nature of being human. So if someone tests negative in that situation, we typically look at their family history and their personal history, and we create a plan to make sure that they are visiting with the correct specialist and doing their routine screenings, just to make sure we're still keeping them as healthy as possible.
That Angelina Jolie comment is good because there's been a lot of celebrities who bring extra awareness to preventative measures or, just knowing your family history in general. I think Christina Applegate was another one too. Um, but as we talk about, myths, there's also fears and guilt around passing on a potential gene to a child.
Yeah, there is. And it's unfortunately pretty common for parents to have these fears, and we completely understand that. We always like to try to remind patients that we can't control what genes we pass on. And part of our job as genetic counselors is to kind of help remind patients of things like that or help normalize some of these feelings and let them know that this is a common thing that patients can feel. And that's actually one of my favorite parts of genetic counseling is that we can be involved in helping families prepare for what's to come, and we can use the results to kind of help control and prevent cancer. So for specific mutations, there are support groups that we can recommend that can help families talk to each other. There's pamphlets and books on like how to talk to family members. We have strategies and tips on how to convey this information to family members. And then we also work with psychologists here at the Cancer Center for patients who want to speak further about these fears in a more one-on-one setting that can really kind of help give them more context or give them more information than what we maybe could provide in our sessions.
Thanks, Jennifer. And another myth I wanted to bring up is data sharing.
Oh, yes. I like this one a lot because having my DNA tested will put me into an international database for solving crimes.
Yeah, there is a lot of apprehension from patients because they think we're going to share their data. I know many of us have heard on the news about those stories, and so patients are often afraid that their DNA results will be shared with their employer or their insurance company, and even affect their employment or health benefits. But there's important distinction between ancestry testing and medical grade testing. And what we do here is we do medical grade testing, which means we send it to specific laboratories that have very strict rules on how they share our data. And in particular, the labs that we use for this medical testing, any information they gather, any testing results are held very securely and are only shared with the patient themselves or the ordering provider. And then within our own appointments, any information we gather in genetic counseling is just contained in your medical chart and definitely not shared with anybody else. So we don't put any of your information into a widely used database. We don't share it with the police. We're very careful to be HIPAA compliant and want every patient to know that they can trust us just like they would their doctor.
That's good. And those are some really great talking points for providers because I'm sure they get these types of questions when it is a conversation between them. But I'm happy to know that my DNA won't be sent for any cold cases.
No, not this one at least.
One last misconception I want to talk about is price. This is something we don't typically talk about when it comes to medical treatment, but it's very important to know what the price is of this type of testing. And it's often a deciding factor as well. And I bet I'm not the only one who hears DNA testing and a faint cha-ching is in the background.
Yeah, that's absolutely true. And we get that question a lot. And the good news is the genetic counseling landscape has changed a lot in the last decade. Years ago, you could definitely expect to pay thousands for these tests. Insurance coverage wasn't very great, and there wasn't a lot of laboratories that offered testing. And so since then, we've had a lot of technological advancements. There's widespread in labs, and that's made it much easier for patients to get testing, and as a result, made it much more affordable. And so now we expect that insurances generally cover testing if your family history has the risks that Jennifer identified earlier. And when I say coverage, I don't always mean that it's 100%. So not every coverage means that you will have $0 to you. But we do know that the majority of labs do offer options where they will call patients if they expect you to owe anything over $100. And so we do have the ability for patients to kind of have a heads up. And then if you don't have any family history, criteria you don't meet that, or you don't know your family, or you're adopted, many labs have offered patient pay prices of $250.
Yeah, it's become really affordable for as more companies get added to this to try to meet the demand of genetic testing. So we have really seen a lot more availability of tests, a lot cheaper prices, and it's way different than when I started 10 years ago, where, like Rebecca mentioned, it was a lot more expensive. It's actually a really good time to get genetic testing cost-wise.
That's great to hear. And it's really, just an important part of your healthcare journey so that you're really being preventative and not reactive when things come up. Another point I want to mention while we're talking is that genetic counselors are available to patients everywhere. Banner MD Anderson offers telehealth options to patients who are 30 miles away from a clinic or if they don't have access to transportation. So it's a really great option for patients, and it creates access to communities all over, both, in the city and in rural communities. But Jennifer and Rebecca, is there anything else that you'd like our listeners to know before we wrap up for today?
Yeah, no, I
Okay.
think you did a really good job kind of talking through and giving us a chance to kind of showcase, what we think is really important about cancer genetic testing. And we did focus a lot today on like cancer genetics. There are a lot of genetic testing options outside of that. We work at a cancer center, so ours focuses on cancer genetic testing, but a lot of these advancements and a lot of the ways that we can use genetics to help our health are applicable in other fields like prenatal and pediatric testing, cardiovascular, neurological, neuromuscular. So there's a whole bunch of ways that genetic testing can help people. And there's genetic counselors who work in all those different fields as well.
Exactly. Well, I want to thank you both for joining with me today. Again, I learned so much from this conversation.
Yeah, well, thank you so much for having us.
Yeah,
Great.
thank you, Caitlin.
Our listeners can learn more about Banner MD Anderson Cancer Center and genetic counseling by visiting bannerhealth.com/services/cancer.